Hi everyone, welcome back to my channel. In this video, we're going to talk about lumbar spinal stenosis. At the start, we're going to talk about what is lumbar spinal stenosis is, what are the main signs and symptoms that comes along with lumbar spinal stenosis, and what are the typical management protocol that you can follow if you are suffering from lumbar spinal stenosis. In addition, I've interviewed my online clients who was suffering from lumbar spinal stenosis, and she has contacted me 6 months ago due to her injury. She was suggested to do surgery from multiple neurosurgeon and a spinal consultant, but she was not ready to go for surgery and she was looking for alternative approach. When she contacted me 6 months ago, she was suffering from huge amount of pain around her lower back, down to her leg. She was not able to walk far. Her day-to-day activity was very limited because of pain. And now after 6 months, she's almost pain-free. She's back to her full capacity day-to-day activity, and she's going to share with you what really helped her in her recovery in this video. If you're suffering from lumbar spinal stenosis, this video I believe can be really helpful for you to understand what really helped her in regards to her recovery. And if you're suffering from this injury, you can always get some tips from watching this video. Now, plus point, I've added a couple of movements that she's been doing in her routine in a day-to-day basis at the end of this video that you can try this movement. They're very low impact. I believe this exercise can help you to gradually manage your pain and gradually build you up to full capacity. You can try these exercises, and if you have any question, you can leave me comments underneath of this video.
Degenerative or age-related changes in our bodies can lead to compression of the nerves or pressure on the nerves that may cause pain and/or damage. Advanced degenerative disc disease may cause lumbar spinal stenosis, which results from a gradual narrowing of the space where nerves pass through the spine, and may be a result of aging and wear and tear on the spine from everyday activities and/or positional changes of the vertebrae that occur as a result. Symptoms of lumbar spinal stenosis may include decreased endurance during physical exercise and activities, weakness and/or loss of balance, numbness and a prickly feeling in your legs, calves, or buttocks, aching, dull back pain spreading to your legs. Symptoms improve when you sit, lean forward, lie on your back, or sit with your feet raised. Neurogenic claudication. If you feel that you are experiencing any of these symptoms, you should see a physician for an accurate diagnosis. If lumbar spinal stenosis is established as a diagnosis, your doctor may recommend one or more of the following treatments based on your individual condition: physical therapy and strengthening exercises, rest and a restriction of physical activity, injections of corticosteroids to help reduce the pain and swelling, medications and analgesics to reduce pain and swelling. Typical medications included nonsteroidal anti-inflammatory drugs. If your symptoms do not improve with other methods, your physician may suggest spinal surgery. Surgical solutions for lumbar spinal stenosis include decompression surgery, laminectomy, and decompression with fusion surgery. I would like to start our call today with Visvesh, who's here, and you guys been working with me for like almost 5 months now, right? And one of the things that is very common, many of my clients has issue with like language and English, you know what I mean, and they worry whether they can get help from me or not. I suppose this is one of the examples that you can still continue and carry on with your rehab, even though if the English is not your main language or you have some difficulty. Maybe, Vishwesh, you can start maybe what happened initially that your mom contacted me, you know, because I suppose she had some injury, and maybe give people who's watching this video some feedback or some background. What happened to her? What was her problem? And how did you end up contacting me?
It's around May of last year, 2024, where the where she had mild back pains like throughout her this past decade. She had some sort of back pain and some sort of issue in this past decade, like ever since 2011. 2011, she had some kind of form of back pain, but it really got on last year only. So 2024, May,
Got
around
you.
1 year, exactly 1 year ago, it really started becoming very severe. So
Got
then,
you.
so we didn't have any option. So we took an MRI. So we went to
Mm-hmm.
we went to a doctor and we took an MRI. We asked them. So they immediately told either physiotherapy or surgery. So now there's no other option to it.
Got you.
So yeah, so
Did they make a diagnosis? What's going on with her back?
yes, sir. By என்ன பிரச்சனை உங்களுக்கு?
Disc bulge.
So they told that she had
L5S1. L3, L4, L5S1.
she had a disc bulge, L3, L4, and L5, L1.
Mm-hmm.
So that is very clear. So either surgery was not an option, so we had to leave that. So physiotherapy is the only option. So we looked around a few physiotherapy clinic locally here, and then
Yes.
it didn't work out properly at all. So then my mom she saw few videos of yours on YouTube, sir.
Got
So
you.
through that she got some idea that there's a way to cure things and there's a way to fix things.
Mm-hmm.
So but then she used to look at your videos and try the exercise on her own, like without any guidance. Like she just go through any video relating to your this bulge or anything, and then she'll try those exercises on her own.
Of
It
course.
did seem good in the initial stage, but then
Mm-hmm.
over a period of time it caused pain and caused there was no clear solution to that also. Like the videos were helpful, but then
I
it was
got
not a fix to it. So then we saw the testimonies. So like everybody's testimony started coming, like and Indian testimonies also.
Yes.
So that made us more more easy for us to join. So like to contact you. Then we mailed you.
Exactly.
Like around November of last year, we mailed you. So from
Yeah.
May to now, it was very severe. It was especially October. She couldn't. She told, like, she's saying that she's not able to. She couldn't get up from the bed.
Yeah.
Early in the morning around October, she couldn't do anything. She was
Then
afraid
if I ask you, like, what was her symptoms look like, maybe if you differentiate them for me, like what was the exactly pain, what was it look like, if you explain that to people?
Back pain இருந்துச்சு. ஃபுல் லெக்கும் வந்து டிங்லிங் பெயின், அப்புறம் வந்து நம்னஸ், கீழே வந்து ஃபுட் நம்னஸ், கிரேட் டோ நம்னஸ், ரைட் சைடு லெஃப்ட் சைடு தூங்கி எழுந்தப்ப இந்த லேட்டரெல்லாம் அப்படியே என்னால சுத்தமா எழுந்து நிக்கவே முடியாது.
So she's saying that she had pain in the lateral leg, numbness in her foot. So like it was very severe when she wakes up in the morning, and a tingling sensation in her her legs. So it got to a point where getting up from the bed was a big deal. So
Yes.
and even sleeping,
Not able to sleep.
Yeah, she was very scared to lie down and sleep. So she was trying to sleep in a sitting position.
Oh my God. That was like sleeping wasn't comfortable in that time. Yeah.
The last week of
October to November middle 1 month வந்து சிட்டிங்ல தூங்கி இருக்கேன், சிட்டிங் பொசிஷன்ல.
Especially from October to November. So like she's saying that those months I have noticed, I've seen her. She was very afraid to sleep. Even if she falls asleep while getting up, it was a difficult thing to get up. So that was the position when we first came around November. So November, in the beginning of November, we did the initial consultation.
I got you.
November end, I'm sorry. So November end, we did the initial consultation.
Yes, of course, yeah. But just if I just go back, when you went to the physio in your local, I suppose, physio, did they give you any exercise or anything to do, or it was mostly treatment?
மார்னிங்கா ஈவினிங்கா 1 hour இது வந்து 4 years ப்ராப்ளம் எனக்கு. மோஸ்ட்லி 2022 ஸ்டார்ட் ஆனது. கொஞ்சம் விட்டு இருந்துட்டு இருந்தது. இருந்தாலும் இந்த டைமிங்க்கு வந்து போன பிசியோதெரபி 1 hour வந்து அவங்க எடுப்பாங்க. அவங்க ஏதோ 2 மணி நேரம் செய்வாங்க. எக்ஸசைஸ், லோயர் லிம் எக்ஸசைஸ் சொல்லி செய்வாங்க. பேக்குக்கு வந்து ஐஎஃப்டி வைப்பாங்க. அப்படிதான் செய்வாங்க. ஆனா அதுல ஒன்றும் இம்ப்ரூவ்மெண்டே தெரியல. இன்க்ரீஸ் ஆயிட்டு இருந்தது, ரொம்ப இன்க்ரீஸ் ஆயிடுச்சு.
Lower limb. So she's saying that they did some lower limb exercises and then mostly IFT. even she used to tell me when she comes back, every night
15 minutes.
15 minutes a day. Daily.
Daily.
So she went every day
Got you.
for IFT and few lower limb exercises.
How many session of the physio she did?
கணக்கே இல்ல. அந்த மார்ச்ல இருந்து அக்டோபர் இவங்கள்ட்ட கன்சல்ட் பண்ற வரையும் போயிட்டே இருந்தேன், விட்டு போயிட்டே இருந்தேன்.
So she's saying that she lost the count, like since March, and from March till October she went non-stop. November. It was even I've noticed, like weekly, 4 times a week, or some weeks
oh my God,
full days also she will go. Yeah,
that's a lot of I suppose.
Yes, sir.
And a lot of physio session. Yeah.
Yes, a lot of position, and she's saying that the pain she increased each time she went. Like sometimes it got down, sometimes it became bad.
Yeah, because when I was basically looking at her like symptoms, the first day that we did the consultation, she wasn't moving much, basically, right? She was very immobilized, and walking was kind of difficult. Like sleeping was difficult. She had pain on one side, quite like debilitating. Okay, then and she was taking some medication as well, right?
Painkiller 1 month தொடர்ந்து எடுத்தேன்னு சொல்ல. அப்பதான் என்னால ஒண்ணும் ஏதாவது பண்ண முடியுது கொஞ்சம்.
Continuously, she took painkillers for a month. So like we were getting scared that what would these painkillers do to liver, kidney or liver or any other. So it got to every day. Without painkillers, she couldn't, especially the last 1 month before the consultation, it was non-stop painkillers. So
I can understand.
Like even when we came, you asked us.
After also
only we stopped the painkillers on the consultation.
The consultation, the program start first day onwards start.
First day.
Yes. Okay, then if we go back to the initial consultation, maybe just describe for people, how did you find the initial consultation? Because it's an hour of call and we talk about her symptoms, we go through her review of her MRI, etc. question. How was that, Vivesh, I suppose?
Yes, sir. So the initial consultation எப்படி இருந்துச்சு முதல்ல யோசனை?
முதல்ல எனக்கு வந்து அந்த பிசியோதெரபி எல்லாம் நல்லா சொல்லலாங்கிறது தான் பெரிய கொஸ்டினா இருந்தது. நம்பிக்கை இல்ல, இவ்வளவு கிளியரா சொல்லல. லேட்டரல் சைடு பெயினுக்கு கரெக்டா சொன்னாங்க, வந்து கரெக்டா கன்சல்ட் பண்ண இல்ல. அப்புறம் கட்டாயப்படுத்தி நீ வந்துதான் அவங்க ட்ரீட்மெண்ட்டுக்குன்னு சொல்லல. இல்ல அது கம்பல் பண்ணல. நம்ம சொல்லிடு இல்ல சொல்லி எனக்கு இஷ்டமா இருந்தாதான் நம்ம போற மாதிரி தான் அவங்க வந்து கன்சல்ட் பண்ணாங்க. அப்புறம் வந்து அந்த பணத்துக்காகவோ அதுக்காக தான் அவங்க ட்ரீட்மெண்ட்டை கொடுக்கணுங்கிறத சொல்லணும். ஏன்னா அப்பதான் தெரியும் நல்லா இருக்கும். அதை சொல்லுனா.
So she's saying that when she first
November 24th அந்த ரேட்ல
அது வந்து மத்தவங்க யார் கொடுக்கறதுனால தான் சேர்ந்தேன்.
எதுக்கு கொடுக்கறது?
ட்ரீட்மென்ட் தான் கொடுக்கறேன் ரைட் சைடுல.
இல்ல நான் வீடியோ பார்த்து தான் சேர்ந்தேன்ல.
இங்க எதுக்கு கன்சல்டேஷன் எப்படி இருக்காங்க?
கன்சல்ட் தான் அதான் சொல்றேன். அவங்க வந்து நல்லா எக்ஸ்பிளைன் பண்ணாங்க MRI ஸ்கேன்.
So she said that the initial explanation was very good. Like we send you in the mail the MRI scans, the reports, and then you asked her to do a few like sitting up, standing up, the position, and then so the initial consultation was like she's saying that I didn't feel like you were very open about it, like you didn't say this is the solution to it, or you didn't like portray a picture where you have to come to your to the program or join the program for a cure. You just told us, you gave us the facts,
information.
Information. This is what is there. This is what is wrong. So even
no money.
So she's saying that that's not a money. So like, you don't think about like coming, like pulling us into it. Like so that's what she's saying.
Yes.
It was just you gave us your real opinion. Real opinion. Clear opinion, she's saying. And she's saying to say that that was the main thing which gave her confidence. Like everywhere we went, some people used to make like any other physiotherapy or doctor or we consulted. Many people portrayed it as a big problem or like a solution which requires a lot of therapy, a lot of surgery.
I know what I mean, because I can understand that, because when we review her MRI scan, she had stenosis, because that was the part that they didn't really inform you very well. You have 2 level of, I suppose, bulges, but one was like kind of severe narrowing of spinal canal. And I think some of the exercise that even they were giving you, they were not really helping you to actually relieve your pain, and it was causing more pain. You know what I mean? And in most cases, if you do have spinal stenosis, you can't just rely on manual therapy and massage and acupuncture or any other type of modality. You need to move. Movement is the key factor. Okay. And anything else that you want to add on in regards to the initial consultation? Like we did the initial consultation. Yeah.
கம்பல் பண்ணல உண்மையா நடந்தது அதை சொல்லணும் ஏன்னா இன்னும் கொஞ்சம் நிறைய பேர் எடுத்துப்பாங்க அதுக்காக தான் சொல்றேன் மணிக்காகவோ அவங்க ட்ரீட்மெண்ட் கொடுக்கலாங்கிறத சொல்லணும் அப்புறம் வந்து நல்லா வந்து உள்ளதான் சொன்னாங்க இஷ்டம்னா வாங்க.
So she's saying, to put it in a simple brief way, she's saying that everybody should know that the first consultation was not any compulsion. She's stressing on the compulsion point, like I didn't feel any like you don't if the only way I can get this cured is by joining Bob the PCR. There was no compulsion like that, so that
of course
made us feel better.
Yeah, I'm glad to hear that. That's great feedback. Okay, then we start her rehab plan after a while, I suppose, and maybe just describe how was the rehab plan initially, because it's the new things that you have to do. How did you find the rehab plan, Vivesh?
Everything வந்து நியூ தான், நியூ எக்ஸசைஸ். வெளியில உள்ள பிசியோதெரபியோட நியூ எக்ஸசைஸ். ஆனா கொஞ்சம் மெதுவா கொஞ்சமா இன்க்ரீஸ் பண்ணி அழகா ஸ்லோவா அந்த பெயினை குறைச்சு அப்படி கொண்டுட்டு வந்தாங்க. ஃபர்ஸ்ட் எடுத்தோம் ஃபர்ஸ்ட் கொஞ்சம் பெயின் இருந்தது, 1 week லைட்டா இருந்தது, அப்புறம் அப்படியே குறைய ஆரம்பிச்சிருச்சு. ஃபர்ஸ்ட் 2 daysலயே குறைய ஆரம்பிச்சிருச்சு.
She's saying that the first 2 days itself the pain started reducing, and then it was a slow gradual increasing of exercise, or gradual, nothing was very quickly rushed or it was very slow. And yes, and then I remember she saw results very like we saw the testimonial videos. So other compared to those, my mother her recovery was a bit quicker. So I don't know how that, maybe the condition was much like a bit easier or anything, but the recovery was much faster, I felt.
I know what I mean. Yeah. Like, I mean, she kind of like, within, I think, I don't know how many weeks it takes her to feel the relief.
15 days
So the second second 2 weeks, so exactly the first every 2 weeks we have the meeting, right? So the first meeting, from the first meeting, end of the second, the second meeting, she felt that there was a relief. Like if you saw the Excel, we can point that we can see the comfortableness. The
exactly. The pain level on the Excel sheet. Exactly. Okay, and in her own I suppose words, maybe just maybe ask her, how did she find the exercises? Like, what was the difference between like the training that I gave her, because we measure a lot of things in that plan, right? Like, let's say pain level, stress level, sleeping hours. We even provide her a diet plan. Does that make sense? How did she find that, like in comparison to what she got before?
இது வந்து பெர்ஃபெக்ட்டா இருந்தது. வெளியில இதெல்லாம் கிடையாது. சும்மா 1 hour எக்ஸசைஸ் பண்ணணும் அவ்வளவுதான். இதெல்லாம் வந்து நல்ல இம்ப்ரூவ்மெண்ட் ஆகுது, தெரியுது.
So she's saying that she could feel the improvement through the Excel. Like each week we see the week one's performance, and then we see the week two. We see the difference in that, and mostly it's more organized. You think
progress
organized. It's more organized, like compared to the other clinics, where it was just exercises and nothing more than that outside.
And plus, like a little bit more, I suppose, more kind of like self-managed, because you basically see your progress in a weekly basis. You have a plan that you know what you have to do in the morning, what you have to do in the evening. Okay, am I doing something wrong? And in a case of like exercise, if you're not sure, you always kind of like record them and send them to me through WhatsApp, and you basically getting a feedback as well as a training wise. Okay, then now we have done almost like 20 weeks of rehab plan with her, and like maybe just share with people how is she getting on right now, you know what I mean, after she's following the plan, like for almost 5 months, and how's her activity look like right now?
Coming to normal life வந்துட்டேன்னு சொல்லி நார்மலா எப்படி இருக்காங்களோ வீட்டுல இருக்க முடியும், ஃபோன் பண்ணிக்கலாம். நார்மலா இருக்கிற மாதிரி ஆயிட்டேன்.
நல்லது.
ஃபுல்லா ரிலீஃப் ஆயிட்டேன்.
அன்னைக்கு ஆரம்பிச்சதுல இருந்து இப்ப மாற்றம்.
அப்படியே கொஞ்சம் கொஞ்சம் கொஞ்சமா தான் வந்தது. ஆனா இப்ப ஃபுல்லா நார்மலா எப்படி இருக்கணும் ஃபர்ஸ்ட் இருந்தோம்.
இது முன்னாடி எப்படி இருந்தது? எப்போ நான் வந்தீங்க இல்லாம நல்லா இருந்தது?
நான் வந்து 2021 அந்த
இந்த பிரச்சனையும்
பிரச்சனை இல்லாம
So she's saying that like 5 years ago, exactly 5 years ago, so like 2021, where she had like not a big, not a very severe pain. Like it was a pretty normal person, like any ordinary person. So from that and these past 5 years, and then right now she feels like the 2021 person. Yeah, where this is just a normal person. No,
Amazing.
no.
Amazing. And like how's her day-to-day activity right now? Like, because I mean the walking was difficult, lifting stuff was difficult initially, or sleeping like was difficult. Like and obviously you're not taking any more medication, right?
Painkillers is
அந்த ஃபர்ஸ்ட் எக்ஸர்சைஸ் அன்னைக்கே ஸ்டார்ட் பண்ணிட்டேன்.
so like even she was very scared. The painkillers was stopped long back, like exactly when the first consultation, first program and started, like for us to measure the pain. So we stopped it from that. She was very scared to stop the medication. Like she was very scared. I remember the day because it'll catch on. Like the moment we get out of painkillers, the pain will catch on. So then for us to, so you gave us the advice that we have to see the progress, so we stopped. So but then it turned out good. Like the pain didn't catch on. We could see the difference before that.
She built up some trust again.
Yes,
exactly.
And then the sleeping also. Like ever since that, she's not now the
1 week அப்புறம் sleeping start.
The 1 or 2 weeks, 1 or 2 weeks after the exercise, she started plan. The sleep was normal. Like she could lie down and sleep and.
Amazing. That's great. I'm delighted. And the other thing is that, like, I think it would be good to mention that, you know, when people follow a rehab plan, if they take painkiller at the same time, it would be very difficult to really differentiate, does the plan helps or not, which means you have to be off that painkiller or whatever it is to measure whether does this exercise helps you or actually aggravating your symptoms. You know what I mean? In that case. Now, if I ask you guys to share with people who's watching this video who has maybe similar problem, they have a spinal stenosis and they told them that, I mean, your mom, somebody told her that she needs surgery, right? Like the doctor that she saw initially, they told her that she needs surgery. Yeah, I mean, surgery obviously is an option in rare cases. You may need that, but let's say spinal stenosis is quite a common thing, and a lot of people has a narrowing of the canal phenomena, and they live pain-free with it. They can function, they can modify things and adapt to it and improve over time. And what we know that let's say your mom has a quite a strong case that we have hope that you can get better. And if you share with people maybe 2 or 3 things that you think help her the most with her recovery, in this whole process that we work together, what do you think would be those tips? Maybe you can ask her and see what helped her the most.
நல்லா இருக்கு. எது வந்து இந்த பீரியட் இந்த 3 நாள் சொன்ன எக்ஸசைஸ் பண்ணதா எந்த விஷயம் நல்லா மாற்றம் வந்துச்சு? உனக்கு ஈஸியா இருந்துச்சு, இது நல்லா பண்ணா நல்லா இருந்துச்சு. எந்த விஷயங்கள்
இந்த இதுல எனக்கு எக்ஸசைஸ் தான்.
அப்புறம் அந்த வேற 2-3 விஷயம் என்ன? எக்ஸசைஸ் ஒண்ணு பண்ணாங்க, வேற
வந்து கரெக்டா அந்த பிளானா பண்ணாங்க. அதான் மெதுவா தான் குறைஞ்சது, மெதுவா அப்படின்னு குறைஞ்சிட்டே இருந்தது. மெயினா எக்ஸசைஸ், அந்த பிளான் ரீஹாபிலிட்டேஷன் பிளான் நல்லா இருந்தது. அப்புறம் வந்து டைமிங் ஆல்சோ கரெக்டா இருந்தது. அந்த எக்ஸசைஸ் டைமிங் டியூரேஷன் அவ்வளவுதான். மெயினா எக்ஸசைஸ் வந்து மைண்டா ஆட் பண்ணது.
ஒரே காரணம் எக்ஸசைஸ் தான் நல்லா
எக்ஸசைஸ்.
She's saying the plan was very useful and the exercises were very important, and most importantly the duration and the frequency. Like weekly we had it thrice, and then the mobility exercises every day.
Yes.
So it was very gradually increasing. So from
mainly mobility exercise.
She's saying that the mobility exercise was the most important thing.
Very good.
She could see the difference. Even if she misses a few weeks of mobility exercise, not irregularly, if she does for a day or so, she can see the pain. So she sticks to it. The mobility exercises.
Amazing.
கரெக்டா பண்ணா நல்லா ரெடியூஸ் ஆகும்.
நல்லா பண்ணா
நல்லா கரெக்டா பண்ணா நல்லா மெதுவா ரெடியூஸ் ஆகும்.
கரெக்டான 3 வேளைக்கு பண்ணணும்.
3 வேளைக்கு.
She's saying that if you do it
more useful ன்னு சொல்றேன்.
3 times a day, if you do it, more and it's very useful also. Like the mobility
Amazing.
One
Movement, yeah, absolutely. I'm delighted to hear that. Excellent. I suppose, Vivesh, I'm delighted with your mom's progress. She's done really well. Is there anything else that you'd like to share? Or let's say, if you were going to do this program again, would you still recommend this to your friends and family? Because one of the things is that people ask, like, Bob, like, what do we do within these 20 weeks? There's a lot of work goes through these 20 weeks that you have to do. We communicate and you ask questions, you know what I mean? Things that, has to modify and change. Would you recommend this plan to people who have a similar issue, if you ask that to your mom? Yeah.
உனக்கு வந்து கண்டிப்பா அப்படின்னா நீ தான் சொல்லிட்டு நல்லாதான் லைக் வேற யார்ட்டையும் ரெக்கமெண்ட் பண்ணிடுவேன். She's saying yes, so like definitely she would recommend it.
Excellent. Glad to hear that. Vivesh, is there anything else that your mom like to share? Because I mean, she has done a great job. We're slowly going to even progress her plan further, you know what I mean, to be able to do everything. But at the moment, at home, she's quite active. She can do everything that she used to do. She walk again, she lift and twist things. Like she mentioned in our last call, she lift 10 kg of water, which is great, and that shows that she has progressed so much. She can trust her back again. And that's another time that I wanted to reemphasize that our back is strong. You just need to give it a right method and right treatment and right load and slowly build it up and get it, I suppose, to the full capacity. Anything else that you'd like to add on, Vivesh?
இதுல என்ன முக்கியமா
இந்த சர்ஜரி அவாய்ட் பண்ணாம அது ஒண்ணு. அப்புறம் கரெக்டான ஒரு ப்ரொசீஜரா அந்த எக்ஸசைஸ் எல்லாம் இருக்கு.
அவங்க என்ன பண்ணணும், அந்த எக்ஸசைஸ் பண்ணலாம்,
என்ன பண்ணலாம்,
நம்ம டெய்லி பண்ணி தான் அவங்க எக்ஸசைஸ் கரெக்டா அது ஒண்ணு இருக்கு.
எக்ஸசைஸ் பண்ணணும்னா அது ரொம்ப மைல்டா தான் இருக்கு. 1 hour 2 hours எல்லாம் இல்ல. கரெக்டா டைமிங்க்கு கரெக்டா இருக்கு. இதை கரெக்டா ஃபாலோ பண்ணணும். ஒண்ணு. இன்னொன்னு வந்து சர்ஜரி அவாய்ட் பண்ணலாம். நீ ரொம்ப டைமிங் எல்லாம் கிடையாது எக்ஸசைஸ் எல்லாம்.
Saying that we can definitely avoid surgery. There's no requirement to rush into surgery.
Yes.
We need to do the exercises are very mild. Like not as you're saying, that doesn't take a lot of time to do. Maximum 40 நிமிஷம் எடுக்கணும்.
30 நிமிஷம் பண்ண இன்னும் ஈஸியா ஆயிடும். இது ஒண்ணும் ரொம்ப கஷ்டம் கிடையாது.
ஃபுல்லா எடுக்கணும். She's saying that it doesn't take more than 40 minutes a day, and then the more you do it, it gets done. It gets completed quickly. So yeah, the mainly she's saying that we can avoid surgery. Like instead of jumping into surgery,
yeah, 100%, absolutely. Thank you so much. Thank you, I suppose, both of you. Thank you for sticking to the plan. You know what I mean, and trust the process. You know, because it is not a quick fix. It takes time, and I suppose all the best with everything.
Thank you, sir. Thank you.
All right, guys. The first move that we're gonna do is gonna be prone position hip flexion, which means you're going to lie on your back and bring one knee down to your chest. We're not doing full flexion yet. We are trying to prepare your body for that movement. This is the opposite movement that we can do. Rather than flexing forward, we're going to bring our hip down to the belly, which is kind of like create the same movement. You start with a single leg and then you bring both legs and hold them there. Breathe in and out. You can do a bit of rocking movement there if you can, if it feels comfortable. You can stay there for 10 to 15 seconds, 20 seconds, within a comfortable range. Make sure that you're breathing and you're relaxing your back. This should be a very relaxed position. You're going to start this routine with this exercise, and by practicing this movement, you're giving a bit of stimulus into your lumbar spine that actually you can flex down. Now, this exercise should be done gently, which means go within the comfortable range that you feel comfortable. Practice it daily, 2 to 3 times through the day. You can do it even in bed, when you wake up, before you go to bed, and try to repeat these as often as you can. The following move that I'm going to share with you guys in this video is going to be a hip 90-90, which is a mobility exercise for our hip. You're going to keep your feet a little bit wider than your shoulder width apart, and your hands going to be as comfortable as possible. You might keep them as close or far away from your body. We are going to rotate the hip to internal and external rotation. In this movement, you're going to hold it in that position for 5 seconds, and gradually you want to get that movement to the point that feels comfortable. As you can see, I'm going with the very slow tempo. You don't need to rush it. This has to be done slowly and gradually. You build movement as you move on. You're going to practice this for 3 sets of 8 to 10 each side. Depends on the time that you have. As you can see, this exercise can be done in bed as well, which means if you have 5-10 minutes in the morning before you get out of your bed, you can try this. Morning stiffness in the lower back is very common. By doing this movement, you can actually improving that mobility and gradually get out of bed with much less stiffness, and you can move on and go to your work. Now, this exercise should be done daily as often as possible to become effective. Guys, we're gonna move on to figure 4 stretch, which is a static stretch that you're gonna do, but it brings your hip to basically kind of external rotation, which means if you're going to stretch the right hip, you're gonna cross that leg on the other knee. By sometimes holding it even there, you might feel the stretch and get challenged. If you press that down, sometimes that's good enough. You don't need to progress that anymore for a couple of weeks, and you can hold it there for 10, 15, 20 seconds, and you feel that stretch and mobility around the hip. Now, if you find this is easy, you can bring the opposite leg down to your chest, hold it there, breathe in and out while you're having that, but it should not be causing the hip come off totally the ground, which means it shouldn't be here. That's not really effective. Your lower back should be on the ground. You hold it there for 10, 15, 20 seconds, 2 to 3 times, and then change legs and do the same thing. Now, obviously, I can feel my left leg is much more tighter than the right side, and it is normal to be tighter in your weaker side, I suppose, and it does not mean that something wrong with it. It's just the way that our body adapts to things that you do into the day-to-day living, and your dominant side is usually stronger and more mobile. That's my personal opinion, just you have in mind. As you can see, you can hold it in that position 15-20 seconds, 2 to 3 times through the day, and you can actually do this in bed. Give it a try. All right, guys, now by doing those 3 first exercises, you're building up that mobility and movement in your lumbar spine and your hip, and it kind of ease off your body to do more. Now, gradually, you can reintroduce forward flexion in a seated position, which means you're going to relax your back, hold your hands next to your shin bone, and gradually lean forward to the point that feels comfortable. Make sure that you don't want to overstretch it or overdoing it. Go within the range that feels comfortable, and you have to be able to drop your shoulder down, breathe in and out, and come back up. You want to hold it there for 10 to 15 seconds. Repeat the same thing once or twice at least through the day for 3 to 8 repetitions. All the way down. Take a deep breath in and breathe out. Slow control back. I'm going to show you from the side. You basically can do this in a dining table, when you're working in the office, a couple of rounds through the day, whenever you had a break, slowly leaning forward, within range that feels comfortable. You will feel some sort of stiffness and tightness around here, but the earlier you do this and challenge yourself, the better it is. You can practice this exercise for 3 sets of 8 to 10 repetitions as often as possible. Make sure that you're breathing, you're relaxing your back, and don't overstretching it. All right, guys, the last move that I'm going to share with you in this routine is going to be child pose or baby pose movement, which is kind of like a progression. When you get more comfortable with your back, this can be an easy movement for you to do, which we're going to basically gradually start in a seated position. If you find here is not really comfortable, add some pillow or towel underneath of your ankle or your basically back of your thighs to get comfortable. You can gradually lean forward to the point that you feel comfortable, which means you're leaning forward, shifting the body to the right and left, breathing in and out, and gradually you lean forward when you feel comfortable. The goal of this movement is to be able to breathe in this position and fill up your muscle, which means that you have in your lumbar spine, with air. Your diaphragm can really expand this muscle and get your ribs out. You want to really practice that movement while you're doing this movement. You want to take a deep breath in and breathe out. Try to stay relaxed in that. Now, and somehow your ankle mobility can really challenge you in this position. You have to practice this over time with maybe 5 to 10 seconds gradually and build them up to 20 to 30 seconds. Practice this exercise maybe in bed because it's more cushioned and comfortable, and you can give it a try in the morning when you wake up and before you go to bed. Thank you for watching this video. If you're suffering from lumbar spinal stenosis, as I mentioned in this video, you do not want to jump to surgery right away unless you have severe compression on the nerve roots or the spinal cord, which has caused severe symptoms such as foot drop or bowel bladder movement, and more complications such as weakness or lack of power in one side. The list of basically this type of symptoms, we call them red flags, has been mentioned in a couple of my videos. You can check them out. But if you do not have those symptoms, you can always try a conservative treatment at least for 6 months. And if that didn't work, then you can look at other alternatives. Because I have so many patients with lumbar spinal stenosis and I see massive improvement with conservative treatment, I believe you could have a chance to get results by following a rehab plan. If you have any question, you can always leave me comments underneath of this video and we can get you started right away. If you find this video helpful, please subscribe my channel for my weekly update and press that like button. Until next week, all the best.